Welcome to Adapt NCLEX. As you review your NCLEX and you get ready to take your exams, sometimes test-taking strategy is the key. And knowing your buzzwords will help you do that. Like, you have to know cues of the way the examiners are going to set questions. So the NGN is all about recognizing cue and then analyzing those cues. And that is what I call buzzword. For school age children in the school nurse office, right? Click the exhibit for clinical data. Who needs to go home? 4 kids. They went to the office. They've been assessed by the school nurse. Who do you think need to go home? Child A, B, C, D. As such, I start doing questions and writing questions. When I see something interesting, it comes to my mind, I'll share with you guys. So this is where we are. I click on the clinical data. Look at what you have. Child A, B, C, D. A, intensely itchy rash with blisters shaped like a wristband. Child B, fleshly, painless, dark-on growth on the hand and the feet. C, slap cheek rash on the face. And D, intensely itchy pimple-like rash with burrow on both hands. This is another way they may ask you infectious control. They may not ask you which room do you put them. They can give you something like that. They want you to think second level thinking. Something has to be ringing into your head. If the kid is going to go home, that means they have something infectious that we don't want it to infect anybody in the school. Which of this do you think is dangerous and need to go home? Test taking strategy, I call it buzzwords. If you know the buzzwords, when you read it, it'll be buzzing like a bee and it will ring in your ear and you'll be able to pick it. 4 kids, intensely itchy rash with blisters shaped like a wristband. What is the buzzword here? The shape of it, like a wristband. So if this is the kid hand, right, with his fingers, there's a rash like that. What kind of rash does it present like that? Unless somebody puts something there, and that thing the patient is allergic to, and it creates a ring around the wrist. This is contact dermatitis. You stay in the hospital. Do you? No. You don't go home. Go back to your class. Whatever you were holding, the wristband, we need to get rid of it because you may be allergic to that, right? So you just say contact dermatitis. We just need to take it out. There's no evidence of the kid having respiratory issues or anything like that. You just put the wristband on his wrist, and then he's allergic to that latest. Fleshy, painless, stuck on growth on the hand and the feet. I just give you a bunch of buzzwords as I write this question and put it together. These are questions like I create, right? Fleshy, painless, stuck on growth on the hand and feet. What do you think? The key word is fleshy. What kind of skin lesion we always say is fleshy looking? How could I give you varicose, but I don't want to give you that word? It's stuck on is an idea. If this is the skin, you see the thing is stuck on like that and look fresh, right? And it's on the hand and feet, right? This is what, right? Skin what, like, so there's nothing to do with it. This is like, we just have to find some nitrogen and freeze this what? Slap cheek rash on the face. When you look at a kid, if this is the kid face and the nose is here, you see a rash here, a rash here. Look like he's been slapped on the face. What do you call it? Caused by it? This is Parvo B19. It's very, very contagious. Very, very contagious. And I know a lot of people will pick this. Parvo B19. A lot of people will pick it. Why? Because yeah, we all know It's a droplet precaution. But when the individual has the rash, the presence of the slap cheek rash, make it not. So if you see the rash, that means the patient is not contagious. The good thing is most of the time we can diagnose it. They have prodrome symptoms nobody know, like any other cold. That time, that's when they're infectious. But as soon as the rash come and we say, hey, yeah, you have what we call erythema infectiosum. This is what we call it. Erythema infectiosum. I will just type it and you see what it looks like. Erythema infectiosum. And so that's the name of the disease process. Erythema infectiosum. This is what we call fifth disease. So far as you have the rash, you are not infectious. So this kid, go back. Even though it looked like he has something going on his face. Test taking strategy. You got to pick this one. Number 4. Intensely what? Itchy, right? He has pimple-like rash. Keyword, burrow on both hands and feet. On both hands. Which condition will make your hand so itchy and it look like there's pimple? You see some black dots in your hand and you see some burrow, like something is going through the skin, right? Can you figure out? If you can start learning these things as you go through infectious control, be able to describe it, like measles, all those rashes. This is scabies, highly contagious. Contact precaution. You go home number 4. This is adapting class. This is questions I'm creating for the on-demand. If you want to get access to that, sign up for the on-demand. On-demand is a high yield, a bunch of stuff like cheap as much as you can. And if you have a lot of time to study, this is what I will use. Spend time, watch the video multiple times. A test taking strategy, adapt and class way. Number 4, we got to call it matter. Take care of yourself and bye.